Good morning. Welcome, everyone. I welcome you to the Intragovernmental Coordinations Committee. Got a couple of different bills. I'd like to make a reminder, if I could, please cut off all cell phones. Yep. I'm going to make that reminder one day, and I'm going to have mine on, and I know it's going to happen, so I apologize in advance. Additionally, if you're going to speak, and we're going to establish some guidelines for that a little bit later on, but we do ask you to make sure that you do it from the microphone, and that we have you turned on first as well. Our first bill this morning that we're going to hear is from Senator Jeff Mullis, and it's Senate Bill 445. Senator.
Thank you, Mr. Chairman. What an honor it is to come before your committee and your esteemed members. I appreciate this opportunity. This is actually a simple bill. I know you've heard that many times. But as you know, Georgia has the second most Civil War sites in any state in the nation. And the anniversary of that tremendous tragedy in our country of brother against brother and state against state, the anniversary is coming up, and it's the 150th anniversary in about 4 or 5 years. And the Civil War Commission came to me with this, and they, even though Civil War and those related interests are historic in reverence, but there is a definite tourism aspect to that, as you know. Tourism being the second largest industry in the state, they feel that their involvement with the State Department of Economic Development would probably be better for them to work on those issues. So this bill simply moves the Civil War Commission and the one person that is in charge of the administration part with the Department of Natural Resources over to the Department of Economic Development. Both of the commissioners of those agencies are in agreement with this. And to give you some further insight, I am co-sponsoring a bill with Senator Zamarripa for a civil rights trail, and we're going to tie these in a certain way and fund them so they can both work jointly together. Any questions, I'll be glad to answer.
Any questions from members of the committee? Anybody in the audience wish to make a statement in regards to this? I'll entertain a motion to do pass this time. First and a second. All those in favor, aye. Opposed? Thanks, Senator.
Thank you, Mr. Chairman. Thank you, members of the committee.
Now move to Senator Chip Rogers, Senate Bill 472.
Mr. Chairman, it is a pleasure and an honor to be before this committee, having served on this committee for 2 years and never having a single bill actually come to this committee. I'm amazed that you have 3 on one calendar on one day. Senate Bill 472 is brought to me by the merit system, and I have Deputy Commissioners Frank Heine and Paul Chamberlain here to answer any questions if need be. But really it's just a cleanup of the way that we handle what are known as our goal-based compensation. Right now, Georgia is one of the few states that allows you to receive a bonus pay that is ultimately calculated into your retirement pay. And while this may sound good for the employees, in actuality I believe it works against them, because what has happened in practice is we have plans now that would give you a bonus money for doing something special or for reaching a goal. And that money at the end of when you're ready to retire would be calculated in, surprisingly, with your salary. So take, for example, a state investor who may receive a big bonus because the stock market went up significantly. He or she may actually, because of the 3 years that he or she received those bonuses, may be able to retire with more money than he or she was making in regular salary. So what has happened, I believe, in real practice is we scale back our bonuses because we don't want to allow those bonuses to become part of a never-ending trail when you retire, something that's almost impossible to calculate. So what Senate Bill 472 does is it delinks what is known as the merit pay and the bonus pay. And it basically says, we're still going to have the goal-based plans. We're going to allow you to receive bonuses, but that bonus that you receive for doing something special or achieving a goal is not going to be included in your salary when we determine your retirement benefits at the end of your career. The commissioners, again, are here to speak on this if you have any questions. One of the other things we put into this plan are safeguards for certifying some of these bonus plans, because right now we're allowing each of the departments to do it separately, and there's no accountability as far as the plan they set up and the rewards their employees may receive with the OPB. The OPB doesn't know about some of these plans, so they may be promising bonuses for money that's not in the budget. So this would also require that the OPB certify the plan and say, look, we do have the money available to compensate you if you were to reach that goal. So with that, Mr. Chairman, I'll answer any questions.
Any questions of the committee?
And Mr. Tommy Hills is here as well, if you need him to answer any questions.
Mr. Hills, any comments you'd like to make to the committee?
No, appreciate. Yes, sir. Thank you. Appreciate the opportunity to address you on this. We think it's an efficiency and a good management tool to pass this legislation. We think the programs that exist in statute now are good, though not widely used. Have been used wisely and appropriately, and this additional change, I think, will make it more appropriate not to have some of this compensation be calculated into retirement. Thank you.
Thank you. Anyone else in the audience like to speak on the bill? Chair will entertain a motion to be passed. Second. Got a first and a second. All those in favor signify by saying aye. Opposed? Like sign. Thank you, Senator Rogers.
Thank you, Mr. Chairman.
And Representative Everson, House Bill 1009.
Thank you, Mr. Chairman, to the committee, and thank you for this opportunity. I bring before you today House Bill 1009, which basically codifies the state of Georgia when it comes to providing public assistance to individuals. And this bill, as it states, codifies the state of Georgia with a federal law that was signed into law by then President Bill Clinton on August the 22nd, 1996, which basically states that unless you can provide positive proof for eligibility for service or your legal status here in the United States, you would not be entitled to public assistance or public service from state governments or federal governments. And those various forms of identification are outlined in the bill. It's a simple bill. The law is on our side. Once again, signed into law by then President Bill Clinton in August 22nd, 1996. And I will answer any questions if there are any. Answer them to the best of my ability.
Thank you, Representative. Is there any questions of the author of the bill from the committee? What number are you? 16. Representative Bruce.
Okay, I just want to make sure that, because I haven't had a chance to actually read this yet. Is the intent to stop people from getting services?
No, it's not.
Okay.
The intent is to make sure that public services that are provided with taxpayers' funds or provided to those individuals that are eligible to receive them. We are not denying public service or public health care to any individual. Those services can be received from private clinics, or they can pay for those services.
Something similar to this came up yesterday across the street in the Judiciary Committee. And I guess I'm trying to make sure, if somebody is sick, they don't know what's wrong with them. They're sick, they don't feel like they have to go to the emergency room, but they go to a public facility, a hospital, whatever, and they're asked the question, are you a legal citizen? They say, most of them are not going to say no because they're scared that the next thing that happened, they'll be shipped out of town. So they'll probably not tell the truth. But if they did, and they say that, no, I'm not a legal citizen, are you telling me that then that medical facility can turn them away?
As signed into law by President Bill Clinton, August 22nd, 1996, it clearly states, a state or political subdivision of a state is authorized to require an applicant for state and local public assistance as defined in Section 1621C of this title to provide proof of eligibility for that service.
Okay, so the answer to my question is yes.
Yes.
Okay, so if a person happens to come in and they have some sort of a communicable disease of some sort, they don't know it, they have some exotic whatever, and if we don't even see what's wrong with them, then we turn them back out into the population, and they could, in fact, infect a whole bunch of people.
They could be.
Statement.
They could refer that individual to an agency that will be able to provide that medical.
They could,
service.
but that doesn't mean they would.
Chances are they would.
Well, we don't know that.
Yeah.
We don't know that.
I understand your.
Excuse me, sir. I'm not going to have that. Not going to have laughing. Not going to have outburst. It's totally unprofessional. Please continue.
Thank you. I take my job very seriously. I am a representative of the state of Georgia, and I am called to be a good steward of the taxpayers' money in the state of Georgia, and that means that I am to ensure that those taxpayers' money is being spent on citizens of this state as required by law. Keep in mind now, President Bill Clinton signed this into law August 22nd, 1996. We're not denying public service or public health care to these individuals. They can receive these services at private clinics. I know in my district there is a private clinic that operates off of private donations where many immigrants come in on a day-to-day basis to receive services. All I'm saying is that Georgia needs to be brought in line with the rest of the nation as far as what was signed into law in 1996, which basically states, in order to receive public services, you must provide positive proof of eligibility of your status here in the United States. That's all the law says.
Yes, briefly.
And I'm not challenging, your dedication to your job.
Okay.
I'm equally as dedicated to mine. And the reality is that I think another part of our job is to maintain the public health. And if we put into legislation, just because the federal government, again, I don't know what the federal law says. I hear what you say, and I don't think you would read it incorrectly. But the reality is if somebody comes in and we don't take the time to find out what's wrong with them, and we turn them back out into the public, we are creating a public health risk. And what's going to happen if we deny people an opportunity to get health care, then they will prolong, their attempt to get it, and they will become more sick, and they will infect more people. And what we have to do as part of our job, we have to be cognizant of the money that we spend, but we also have to be cognizant of how we protect the public.
Is this a question, Representative Bruce?
Well, no, that was my statement.
And I agree with the gentleman, the distinguished representative, and if you would read the bill on page 2, it does address a lot of those areas of concern. We're not just going to turn those individuals out, as you see on line 1 there. Any further questions?
Any other questions from the members of the committee? All right. Since we have a list here of some people that want to speak on it.
Did you just ask if the public had any questions?
No, ma'am.
Okay. I was reading over her shoulder.
Thank you. Since we have a list of people who would like to comment on the legislation, I'm going to allow it. Obviously, I want you to be brief. It'll be at the discretion of the chair. And frankly, I don't need redundancy. I know a lot of you are here from the same organizations and have been organized for that purpose, and I understand you, and I want you to be able to have your time, but we don't need to be, frankly, repeating ourselves. So with that said, and if I butcher it, I apologize, Dr. is it Geo Rust? George Rust? And given the volume, we're going to ask, if at all possible, about a minute, minute and a half each.
I'll go as quickly as I can. Thank you very much, Mr. Chairman, distinguished members of the committee. Thank you for allowing me to speak. My name is Dr. George Rust. I am director of the National Center for Primary Care at Morehouse School of Medicine, where I've spent the last 15 years currently as a professor of family medicine with boards also in preventive medicine. Prior to that, I spent 6 years as medical director of the West Orange Farm Workers Health Association in Central Florida. So I've cared for a lot of individuals in my career who haven't had resources to get health care from other settings. I've cared for a lot of immigrants and, frankly, some of the most hard-working American work ethic kind of individuals that I've ever had the privilege to care for in my career. I've seen during that career some tragedies that occur sometimes with well-intended policies and procedures and legislation. I've seen babies born in hospital parking lots trying to time the delivery to make sure that they could get into care. I've had to put tiny little tubes down there, tiny little windpipes, trying to save those babies. I've seen young women have to go on dialysis because of kidney infections, bladder infections that could have been easily treated. People who had cervical cancer and died from cervical cancer for lack of a pap smear. Diabetics with leg amputations and blindness. Patients who have stroke for lack of blood pressure being treated. In short, many individuals suffering horrible consequences because of simple lack of access to primary care and public health services. Now, you may think that this bill will only have such an impact on undocumented immigrants, but I can assure you that unless you broadly exempt all health and health-related services, this bill will hurt all Georgians. There are unintended consequences of this bill. And I can tell you that the very first consequence is that you're going to add bureaucracy to a healthcare system that, in my view, doesn't need more paperwork or more bureaucracy. If I have staff checking paperwork from individuals, not just immigrants, because think about this for a minute. Every Georgian is now going to have to carry documentation of legal status, because the alternative in our clinics would be to engage in profiling and only to ask for documentation from individuals that, through my filter, looked foreign. And so the potential for bias here is tremendous, and the alternative is that we ask for documentation from every citizen who seeks health care, not just in public clinics, but in any organization that receives state funding to support their good work. And so it will create an access barrier for all Georgians. This creates a public health problem as well for all Georgians. Imagine an avian flu epidemic. Imagine multi-drug resistant tuberculosis and individuals who have been driven underground and don't even approach the clinic because it has a reputation for checking documents. The healthcare system will also be put at risk because if I can treat the urinary tract infection, it might cost you $10 or $20. If you end up putting a patient on dialysis, or if the patient ends up with an amputation in the hospital's going to eat the bill on that one. And you're going to have rural hospitals in jeopardy of closing because there's so much on the financial brink that they can't afford indigent care for conditions that could have been treated easily in outpatient settings. Don't try to parse the details. I'll close here with just one significant point, I think. Please don't try to parse the details and say communicable disease or pregnancy. Folks, from the patient's perspective, will not parse those details. They just won't come.
Thank you, Dr. Rust.
May I make one final point, sir?
Briefly.
I'm here for the students, for the idealism they've shown. They convinced me to come, that we could make a difference. They haven't had to work in the system that we used to have in this state where health care was segregated. And that segregation was enforced by health professionals. That was wrong. And those of us who have thought deeply about it have decided in our hearts that we will not be part of that again. So don't pass this bill. If you pass it, please broadly exempt health and health care. And if you do pass it, don't expect health professionals to enforce it. Thank you.
Thank you, sir. I'd like a question on that last part, Dr. Rust.
Yes, sir.
You said, what was the last statement? Don't ask
us to enforce it. I think what we don't realize is that these private clinics that were described as being an adequate safety net for the immigrant population. First of all, we have surveyed the safety net in Georgia. We have done inventories of that. There is not sufficient capacity to do that. Secondly, many private sector organizations do receive state funding and in some way could be perceived as subsidizing care for immigrants. And so many of us who may not consider ourselves part of the public system, a residency program at Morehouse School of Medicine, for example, that runs a family practice center, might now be in the position, because of state funding that we receive, that we would be checking documents on every patient who comes to our doors.
Thank you. Miss Susie Maritel, did I butcher that?
Close enough.
That's a yes for butchering, y'all. But I appreciate your politeness.
Thank you for allowing me to speak here today. My name is Susie Martorell. I'm a social worker in a community clinic in DeKalb County. I've worked as a social worker over 20 years, primarily with the immigrant population, both in California and in Georgia. I see lots of families on a daily basis at our community clinic in DeKalb County, and I'm very concerned and I oppose this bill 1009 because it will wreak more havoc on the healthcare system here in Georgia and the families and the parents and the children that I see on a daily basis. My greatest concern is that it will create and add to a climate of fear, and that it will add to disparities in health care. As the doctor previously said, we're going to see another whole segment of the community which is increasingly denied access to health care with this climate of fear and requirements that are posed in this bill. I'd like to bring to everyone's attention that in Georgia, 25 years of age is the median age of Latino Hispanic persons living in Georgia. These are young families. This is a young community. They are childbearing. They are having babies that are born here that are U.S. citizens. When we deny access to care, when we impede access to care with a bill like this to fathers and mothers who are out working and caring for their children, we're going to end up with those parents having larger bills, being less able to care for their children, being less able to stretch the dollar. Yes, they can go to other private facilities, but when you don't have the money, you can't go. And when public services that are provided to the general population are denied a certain segment of the population, that population gets sicker, and their sickness crosses over into other communities. Families are here to work. They're not for benefits. I think this is misdirected action. Employers are the ones who we should be setting up more restrictions on how they hire undocumented. If they wouldn't hire undocumented, they wouldn't be here. But they're not going to leave and they're not going to disappear because we take away health care. They're just going to be creating an unhealthier population in Georgia. A Brandeis University study in the year 2003 documented that across the United States, 70% of Latino families have mixed documented and undocumented persons in their family. Certainly the families I see are typically, the parents, more often than not, are undocumented. They have come into this country illegally, but their children born here are U.S. citizens. I just today, before I left the clinic, saw a woman in my clinic, I'll call her Anna, and she has 4 children. She and her husband, first her husband came, which is a typical story, and later he sent for his wife, and they are both undocumented. They have 2 children that they brought from Mexico to this country, and they have 2 children that are born here. I was helping her do her Medicaid application for her children who are U.S. citizens, and going through the requirements of what she needed to provide, and having to provide proof of income when her husband's paid in cash under the table was the biggest headache and problem for her. And she told me, Susie, I feel like throwing in the towel. I'm worried about the costs of paying for my other children who don't have Medicaid, one of them who has severe asthma, but my other children who are eligible for Medicaid, it's just so hard hard to get Medicaid. It's so hard to prove my income. And I encouraged her and stressed with her the importance of providing the best health care for her children. Don't be discouraged. Don't turn away. It's so easy to turn away and give up. And I begged her not to do that, and we completed the application. But that's the kind of, when we create more bureaucracy, more documentation, the reality is Latino, Hispanics, or any undocumented persons in this state and throughout the country are not receiving benefits they are not entitled to. They must provide documentation. May I make one last comment and I'll wrap up? Sir, may I?
Please.
I would just like all of us to imagine what the state of Georgia would be in a few years, if 3 years from now, if a bill like this were passed. The impact on emergency rooms, the impacts in our schools where children, 1 in 12 children in schools in Georgia are immigrants.
On the issue of financing for the illegals, let me ask you this, if I may. As a social worker, what kind of education do you give on perhaps them saving money, putting up their own medical savings account, if you would, though? And I know they're not going to go to the bank, but as opposed to sending it back, what kind of education do you have in place that actually helps them save some money here?
We have clinic classes at our clinic, about 4 or 5 a year, with all sorts of topics, trying to get them to enroll their kids in Head Start and pre-K programs, etc., the kinds of resources that are here available for their children. We recently had consumer credit counseling come out to our clinic.
Do you have a medical savings account program that you educate the...
We don't have possibility for that in our clinic, but we do focus on education of using their money wisely and putting aside money and keeping documentation so they can apply for programs they are eligible for. It's a population which generally doesn't hold on to documents like we do in the U.S.
Thank you.
Thank you very much.
And I thought Martorell was tough. I still did it. Let's try Dr. Jason Pietrowski.
Mr. Chairman, Dr. Krastowski is an emergency room physician at Emory, and he was on a night shift. He was going to try and make it because he feels strongly about this bill. However, he cannot. Thank you very much, sir.
Thank you. I assume he feels strongly in favor of it. I'm joking. Doctor, I don't want to give you too much credit here. Jesus Lemieux.
Thank you. Good morning. Thank you for your time.
I got to start enforcing the time because I've been really generous.
Good morning. Thank you for the time to listen to our concerns regarding the House Bill 1009. My name is Jesus Lemus, and I'm a Fulton County resident. I graduated Princeton in 2001. I am a third-year medical student at UCLA and currently on a 2-year leave of absence to attend Emory University's MBA program. And I am also the son of illegal immigrants who came from Mexico and became legal residents in 1987. I oppose House Bill 1009 because of its devastating impact on immigrants' health, which directly impacts their children's health and well-being. I am also here to ask that if this bill has to be passed, that exceptions for prenatal care and children's health, and that the Attorney General's specifications for 1996 federal welfare reform to protect public health and medical services are explicitly listed in House Bill 1009. We cannot and should not play with children's health, many of them who are and will be Americans by birth. Personally, my family benefited from the health services. For example, my father had an urgent hernia repair when he injured himself while working as a butcher, and he had done this for over 20 years in California. My mother benefited from prenatal care. She has raised 10 children who contribute to our American society in one way or another. My 9 siblings and me, we had our vaccinations in time to enter elementary school because my mother trusted the doctors and nurses and the American healthcare system. Now my siblings and I are living our parents' dream. We're Mexican Americans who are contributing to our communities. We pay income taxes and do volunteer work in our communities. Personally, I volunteer at hospitals and nonprofit organizations like Habitat for Humanity in order to improve American communities. In the future, as a physician, I look forward to reaching to all of my patients, regardless of their countries of origin. America has to continue to welcome immigration, as most of us, at one point or another, had our parents, grandparents, or great-grandparents who came here to America in search of greater opportunities and better futures for them and for their offspring. Thank you for making the necessary changes to House Bill 1009. Thank you for making exceptions for prenatal care, for children's health care, and for the Attorney General's specifications. Thank you for listening, because with your support, our children, America's future, will receive the medical attention they need and the medical attention they deserve.
Thank you.
Thank you.
Julie Solomon.
Thank you, Chairman, Committee, for allowing me to speak today. I just wanted to reiterate what the other people had said, and also I'm a first-year medical student at Emory University and hopefully a future Georgia physician. I'd like to be able to stay in the state and practice and take care of all of its population. I wanted to specifically address the fact that children are not protected by this bill and that it punishes innocent children who come to this country by no decision of their own. Prenatal care right now is covered by several different sliding scale programs. There are set plans like the Grady Baby Plan. There's also a program called Babies Born Healthy that provided care to about 4,000 women, many of them who were Latina and not with documentation. So that was 4,000 new Georgia citizens who were born this year. Prenatal care, the reason this program was set up is because prenatal care helps to prevent low birth weight babies. Low birth weight babies are 20 times more likely to have death or disability in the first year of life. When they're born into this country, they're U.S. citizens. Their mother's care is retroactively paid for by emergency Medicaid, which means that that's being paid for by taxpayer dollars. If these babies are born with problems, every day they spend in the hospital is costing the U.S. taxpayer thousands of dollars that could easily be prevented by simple prenatal care. And I would also like to emphasize that children's services are also not protected under sliding scale clinics, so children are denied access.
Thank you so much. Hunter Butler.
Hopefully the last few names have been a little easier to pronounce. Mr. Chairman, committee members, thank you so much for your time. My name is Hunter Butler. I'm a second-year medical student here at Emory, and I plan on staying in Georgia and raising my family here. And the reason I really feel strongly about this bill, Julie just addressed most of it, so I won't be repetitive, but the prenatal and baby aspect of it, these are innocent kids and innocent children. And I really feel it's our responsibility, not just as a medical student and future doctor, but as American citizens, to look out for their rights. I mean, if you want to look at the money part, they've talked about it, it ends up being more expensive. And they end up in the emergency room using state tax money anyways. Political view, they are Georgia citizens, they are our future. One real quick passage I wanted to read. It's from Proverbs. Speak out for those who cannot speak, for the rights of all the destitute. Speak out, judge righteously, and defend the rights of the poor and the needy. And I really feel like this is our chance to defend those rights, and this is our chance to make a difference in their lives. I know and I understand that you all have a responsibility to get your constituents, and the people of Georgia want something done about immigration. But I'm asking you, please exempt health care, or at the very least, make an exemption for children and babies. This is our chance to make a change in their lives and a change in the future of Georgia. Thank you.
Thank you. Dr. Nasseri.
Good morning, Mr. Chairman and honorable committee members. Thank you very much for giving me this opportunity. My name is Hogai Nasseri. I was born in Afghanistan, and I'm a naturalized American citizen. I came to Georgia when I was 8 years old. I attended West Georgia College and graduated from Medical College of Georgia with my MD. And I'm a family physician, and I've been practicing here in Georgia for the past 8 years. I'm married to a Georgian. I say all this to emphasize how committed I am to the state of Georgia. I've spent the last 8 years working with the underserved here. Currently, I am the Chief of Service for Community Medicine for Emory University, and that means that I'm responsible for 4 of our Grady Neighborhood Health Centers. 2 of those neighborhood health centers serve kind of the traditional inner city population. 2 of them serve more of a diverse population like we see in Chamblee and North Fulton. One thing I'd like to point out is that within the Grady system, The two clinics, actually the three clinics that have the highest cash collections are clinics that serve undocumented immigrants. These folks come to this country knowing they're going to have to pay for health care, and they do pay, because they come from countries where you have to pay up front before you pay. Now, if you look at our other clinics, their cash collections, it's really negligible. If we don't get Medicaid and Medicare at those sites, we really get no revenue whatsoever. It's really dramatic, the difference. So I want to make that point that our patients actually do pay, and they're quite proud to pay. They don't want free care. As someone else pointed out, they don't get Medicaid. I mean, I can tell y'all, Americans today can't get Medicaid. Okay, I have patients that have been applying for it. We can't get it for them. It's very difficult. And I understand why. We've got limited resources in this state. My children are Georgians. I want those resources for them too. My in-laws go to Wyuka Road Baptist Church. They're really Georgian. I know how they feel. You know, they're not like me, just, immigrants, but I see that point of view. But I also see the fact that I don't want my child going to school with kids who have not been immunized. And even if we make an exception for children, the fact is these things get distorted. The word gets out that, but they'll report you if you take your child in there, even though your child may be a citizen, you're not. And it becomes a public health issue. The whole reason we have public health departments, and they're called public health, is because one person's health has an impact on the public. I mean, we can talk about avian flu, things that are kind of exotic. Let's talk about the more mundane things like measles. Those things, those outbreaks still occur, meningococcus. And if we start chipping away at that, I mean, it's already a very weak system. I mean, I tell you, I work at Grady. I know what it's like there. I know what I see in my American patients and my immigrant patients. And it's scary. I mean, we're struggling to try to keep the things together. You break that link a little bit, and I really fear for what might happen. The one other point I wanted to make was that my husband, who, as I mentioned earlier, he was born at Georgia Baptist. He's American. He really discouraged me from coming here today. He said, honey, you've got so much on your to-do list. Your secretary is so mad at you because you're so overextended. Don't cancel it, because he said it's not going to make a difference. And I'm an immigrant. And one of the things I feel strongly about is I do not take being an American for granted. I remember the day I became a citizen, the day I took that oath, and I take it seriously. And I believe that this process does work, and that y'all do hear what we say. Even if I can't change your mind, I am so grateful that I had the opportunity to speak to y'all here today. My sister moved back to Afghanistan after the Taliban fell. That's where I'm from originally. And she's an American citizen, and she's trying to help them rebuild. And I tell you, these are the processes that they are struggling to put into place there. And they are so far from that. And I'm so grateful that we have that here. And I just want you to know, I'm going to make sure that I tell my husband I said this, that as an immigrant, I value this process and I participate. And I think there are a lot of Americans out there who take this stuff for granted.
Thank you so much. Janice Barosas.
Mr. Chairman, I'm Janice Barocas. I'm with the Women's Policy Group. And you've heard from a lot of health professionals describing sort of the concerns, the climate of fear that this bill might create. I'll just make several points about the earlier discussion about the ability to create a verification procedure for folks who are accessing these public health services. And I think it was said well earlier that, yes, we can create a verification procedure, but as I read House Bill 1009, that's not what it does. I actually read it as a blanket denial, and it includes the federal exceptions, but what we have is, and it was said by the previous speaker, two issues to deal with. What does the law say, and what is the perception of the law? And I think creating a climate of fear is something that we, you as lawmakers, and we as advocates need to be very careful about, because essentially if the reputation, particularly in mixed status households, is that there's a danger of the undocumented mother and her status being verified as she brings in her immigrant child and potentially her citizen children for health care services, she's going to stay away. essentially. That's a decision that has to be made by family, case by case, but some misinformation and a lot of information about Senator Chip Rogers' bill, I think, that has gone out in the media, and the Women's Policy Group has worked very closely with Senator Rogers to improve the language related to his verification procedures to spell out exactly what is exempted. Services for children under 18. Prenatal care, all of the Attorney General's specifications, and all of the federal language, which was referenced by the author of the bill, that actually lays out these baseline health and medical services are not required under federal law to be verified. And for delivery of these services, I just encourage the committee, before I take any more of your time, to defer this bill. If one of the things that we want to do is address this issue, a lot of work has gone into Senate Bill 529. Yesterday in the committee, a similar issue was raised. That subcommittee made the decision to defer this bill. Senate Bill 529 will be coming onto the floor on Wednesday.
Thank you so much. I do have a question for you. I'm a little confused on the reality versus perception of the law.
Sure.
I'm just a simple country boy, and I was raised with ignorance of the law is no excuse. Can we draw lines? Can this body draw laws? That can be so vague as the perception is what we deal with. Are you not suggesting that?
I'm not sure I understand your question.
Well, you said the implementation of the perception of what's not true, and it'll get sent away, and this and that. That's the reality that we'll deal with, is that perception.
I think it is.
And I'm questioning you on whether you believe that laws should be passed based on perception.
No, you're passing law based on your intentions, and it's absolutely the responsibility of the person coming in for health care services to understand where they stand in relation to that law. But I think because we're dealing with complicated federal issues, and essentially there's a debate, kind of going on the sidelines here about whether this is even Georgia's issue to resolve. There's complicated federal matters at play, whether or not a state agency, and in the language of the bill as I read it, is violating the law by providing any services, has created so much concern to the point where we've had private health care providers saying to us, well, we've jeopardized our medical licenses by providing fee-for-service care to people who are undocumented. And when I hear a question like that, which I do not read to be a part of this bill or frankly any of the others that are pending right now, it tells me that it's our responsibility to try to be as clear as we can about what we're doing. And because it's a federal state issue and because it affects essentially public health as a whole, I do think that it's the duty of the state to protect public health.
What number? 15? Representative Coleman.
Sorry. I want to ask a question, just pursue that a little further. Probably in our communities, the number one issue we're hearing from constituents, you've got to do something. You've got to help us. Mm-hmm. Taxes. We having to buy hospitalization. We're having to do this. It's costing us more. We can't get health care. What are we doing? What can you suggest? And I talked with a good friend of mine from Berkeley Lake here earlier that you could help us in Berkeley Lake to communicate to the community. What could you suggest that we do to help the 95% of our constituents to say this is number one? You do something about it. So we're caught with this, and I'm very sympathetic. I'm very sympathetic. I agree, and I don't want to deny anyone health care. They need it. And children are key to me. But what can we do? What do you suggest we do with this population that's in an uproar?
I don't have a simple solution. I wish that I did. I think that it's a much larger issue than the immigrant issue that you raise, and I think that it deserves appropriate time
Where do we?
for discussion.
And I love what I hear. I just feel like these students that I'm hearing and the doctors, in our communities, I'd love to see my medical profession hold community hearings and express this. You talk about time. It's an issue we've got to deal with at the PTA level, at the lower level, and we're just flooded with that and with eminent domain. Those are the two things. Don't take my property and don't take my health care. See what we're dealing with.
I appreciate your concern. Thank you, sir.
I want your help. I'm asking your help.
I'd be glad to help you with that. Thank you.
Thank you, Representative. Just a couple others. Reverend Phillips.
Thank you, Mr. Chairman, members of the committee. My name is Wendell Phillips. I'm a member of the Public Policy Advocacy Committee of the Presbytery of Greater Atlanta. And I know that, like you, I've been enriched by the testimony that I have heard this morning, especially from the medical students and the physicians who are here and others. The future of medical service in Georgia is certainly in good hands, and I feel comfortable with that. I concur with everything that we've heard so far, and you'll be happy to know that I'm going to forego most of the eloquent oratory that I have prepared designed to sway you to my way of thinking. I can only say that my congregation, I'm sure, wishes that they had you as a timekeeper on Sunday mornings. But I do want to skip to my last point that I was going to make. I think it involves something that has not been said, at least from the standpoint of the faith community, at least the faith community that I represent. The Presbyterian Church USA has long held that any laws enacted with regard to immigration, including laws governing the growing number of undocumented immigrants in our society, should be based first of all and foremost on compassion. Following the biblical mandate to welcome the strangers in our midst and to try our best to serve their needs in the same way that we would want our own needs to be served. At the very least, a bill such as House Bill 1009, if you decide to pass it, which we certainly hope you will decide not to, should contain specific provisions for the well-being of children, as you have heard, but also absent from the bill is any recognition of the human tragedy brought on by unscrupulous notarios, that is, people posing as officials who dupe unsuspecting immigrants into thinking they can help them gain legal status for a price. Or traffickers who virtually indenture undocumented women immigrants and sometimes even children and exploit them for private gain. The need for compassion, and to add that to our discussions when very challenging legislation such as this one comes before us, I think is crucial to our coming to a good, serviceable, and workable and compassionate decision on this bill. I thank you very much for this opportunity to speak, and I thank the ones who have spoken before me.
Thank you so much. As a former radio guy, I got to tell you, you got a great voice.
Your part, if I may, I think you've hit on something that the communities need to do. We wouldn't need the law. If our churches, our schools, our PTAs, it's got to bubble up. Something's got to bubble up. You need to get these organizations. I'm Southern Baptist. We need to do more. We're doing things. But I agree with you. I think we've got to have all of us.
Let's work together.
We got to. We have to.
Thank you.
Alina Perez.
Buenos días, mi nombre es Elida Pérez Knapp. I am here to oppose the Bill 1009 as in the language for post-secondary education. I am the daughter of migrant farm workers. I used to work in the fields. I am the granddaughter of an undocumented, but that was way back in the dark ages when the word didn't even exist. So I have had a chance for a better life because I was born in the United States, so were my parents, born in the United States. And this is a wonderful place to live. That's why the undocumented come here, because they also choose to have a wonderful life. They would not leave their country if they could have that wonderful life where they're from. They have a lot of grief of leaving their country. They come here for a better life, not so much for them, the adults, but for the children. They want a better life for the children just like all of us do. So I am asking you on behalf of the Latino families here that are new to this country to take into consideration post-secondary education. I have a daughter who's a teacher, a son who's a chemist, and that is because of higher education, because we live here in this country that offers these opportunities. We want these children that are being born here from undocumented. We want them to become the teachers, the nurses, the salespeople, the newspaper reporter, the politicians of Georgia's future. They are here. There's nothing we can do about it. They are here in Georgia. They are working, they are surviving, they are thriving, and they are paying taxes. They are building homes, they are cleaning rooms, they are cleaning houses, they are cleaning the chicken that we might go eat at lunch right now. They pay those taxes in those jobs that they have. And so I am asking you to please consider higher education. Take this. I oppose this bill, first of all, because it's very unfriendly, very anti-immigrant. And I think it's up to the federal government to fix the immigration issue. So in the name of Latino families, I am here.
Thank you so much. Jennifer Fall.
Hello, and thank you for listening to me this morning. My name is Jennifer Falk, and I'm on the State Board of the PTA, Georgia PTA, and I chair our diversity inclusion initiatives. Thank you so much, Representative Coleman, for bringing up the fact that things need to be a community solution. And I'd like just to take a moment and address some of the issues that were brought up today and what the PTA, the largest volunteer advocacy organization in the state, 320,000 members, is doing. First, we're reaching out. We're reaching out to organizations. We just sat and we spoke with Maldev about reaching out to their organization to educate parents and children. We're the organization that doesn't ask whether a child is documented or undocumented in any way. One of the questions that brought up was, are you teaching parents to save for medical expenses? The Georgia PTA does have a program that all students are accessible to teach students to save, whether you're here as an undocumented child or a citizen of the United States. So we're putting those programs in place. We're also the organization that educates parents and hopefully partners with organizations for special needs children. When you talk about not giving prenatal care to children who are born as U.S. citizens, we're the organization that then supports parents in the K through 12 system to educate them what their rights are. And it ends up costing every child that's born with a disability, as you know, is a much higher child to educate in our K through 12 organization. But today I'm here to read a position from the Georgia PTA. The Georgia PTA believes that the highest purpose of education is to open the doors of opportunity and self-sufficiency to every child in our state and nation. By prohibiting young adults who might be illegally in this country through no fault of their own from earning a post-secondary education, our concern is access to post-secondary education, as well as some other issues that were brought up here. House Bill 1009 closes the door to that better, brighter future for the children of immigrant families who want to go to school, better their lives, and become contributing members of our society. National students who go on to post-secondary education provide benefits to society as a whole by increasing their long-term earnings potential, decreasing incarceration rates, and lessening the burden on social safety net programs. Georgia PTA is working under our national PTA position that encourages all graduates from Georgia's high school to go on to post-secondary and vocational opportunities because we see an educated, successful populace as a benefit for Georgia as well as the United States. Thank you very much for your time.
Thank you. Paul Von Egan.
Hello, committee members. Thank you for letting me speak. I'm Paul Vamagan. I work with the Mexican American Legal Defense and Educational Fund as a policy analyst there. We're a Latino civil rights group, a national Latino civil rights group, which deals in the areas of, we do advocacy work, we do a community outreach. We're currently working on implementing a financial literacy program within our outreach program. And we also have a large experience in the area of litigation, specifically with these matters of the issues of creating state systems to that relate to services and denial of services and protection of services. The example was out in California in the mid-'90s with Proposition 187. Right now we're still in litigation in Arizona with Proposition 200. Basically our concern and why we are opposing this bill 1009 is that the PRWRA, otherwise known as the Private Responsibility Act, defines basically the eligibility of undocumented immigrants to state and local benefits. But at the end of that Section 8 USC 1621, there's a subsection D which says that states can only positively legislate in terms of giving undocumented immigrants additional services. When they start creating systems on the state level that ask to verify immigration status, that verification process is creating a system of really determining, and the only systems that exist right now are the SAVE system, which is for federal benefits and welfare benefits, and the states are allowed to use that. But we have to ask the question: how are we going to enforce this? How practically will this play out? And my concern is that you're going to have to create some kind of state system to verify, and that's really not in the state's jurisdiction. We know that the federal government has a responsibility to create these systems, and I hope, and I'm not sure, but I just hope that the representatives and the senators at the state level have been talking with our federal legislatures, because the Senate Judiciary Committee right now this week and the past week is currently discussing a comprehensive bill which will address the concerns you have. I think the main concern is the issue of documentation. There's no way for people to pay in, as you say. Many undocumented immigrants are paying in. They are using documents, tax ID numbers, and so forth. And we expect that over half of the undocumented population is paying and not receiving those services. But I just want you to ask yourself practicality. There is an exception in this bill that says that people are allowed access to vaccines, but just finish off this point. People allowed access to vaccines, but how is the person in charge of intake at the hospital going to verify whether this person potentially has something that could be treated with a vaccine? Are they doctors? These are the questions we need to be asking ourselves in terms of practically how is this going to play out. So I encourage you to talk with your congressmen, your senators currently who are discussing this issue on the federal level.
Thank you. I just want to make sure now, when we, in South Georgia, we say when we shuck it down to the cob.
Yeah.
Right? When we shuck this down to the cob, you represent an organization that sues states who try to implement safeguards for undocumented aliens?
Safeguards. Can you wait? You're saying that our organization sues states for
when you have litigation pending?
We have litigation pending. We're not trying to sue the state. We're just trying to make sure that the state complies with federal law. That's our only objective.
Would this bill do this?
It would not comply with federal law. And let me clarify that you should definitely speak with our regional counsel, who is an attorney. I am not an attorney, but I've hung out around her a lot, and have gone to a lot of these meetings and know that this is her general argument.
Thank you so much.
I appreciate it.
Any comments from members of the committee? Any questions? Please, Representative Bruce. What number? 16.
I just want to say very quickly that, everybody in this country, other than maybe some folks from the Cherokee tribe or some other Indian tribes, came here from somewhere else. And the reality is that this country has been as great as it is because we have accepted people from all over the world, from all kinds of backgrounds, that they brought that to bear here. And this legislation, as I understand it, interferes with a tradition in this country of acceptance and welcoming people into our fold. And I would encourage us all to vote against this bill.
Representative Coleman, 18.
I want to say that I appreciate your time, appreciate your comments, and as I said earlier, I think we just are touching the tip of the iceberg. I mean, this is something that's not going away. It's only going to increase in concern and a weight on all of us. And I think all of us are going to have to do it. And I see you young, I assume all of you are young physicians that are in school or practicing, you doctors. I encourage, and I want you to come out there to Gwinnett County and help us out. I mean, we need to give your time as much as anyone else. You need to open your clinics. You need to provide the health care. We need to do this. We need to help out, all of us. Churches need to. And I think we're just starting. This is not going away. And you're going to see more and more legislation like this. And someday it's going to happen if we don't start now. The churches and others and schools, we're going to have a problem we have to deal with. I agree with my friend here. I encourage people to come over. This country, that's what it's for, the country of opportunity. That's what we're a country built on. Coming over, making the dream come true, catching that dream. I want them to become dream catchers, but I want us all to pay our share. And that's what we're all trying to do. So I'm like you. I don't know if this bill's where we want to go or not. I'm having some concerns too.
Thank you, Representative Coleman. Representative Howard.
Yes, I too would just like to state that I would like to say that I am in total agreement with my colleagues here this morning. This bill has totally stirred me to the point that I truly feel that I could not vote on this bill to deny children or women who need prenatal care or even other types of diseases that are out here. I think that we should take a deeper look at this bill and maybe defer it if nothing else. Thank you.
Thank you, Representative Howard. As chairman from South Georgia, and this is a problem that's universal. Really, you see it in more parts of the state, more parts of the country than others. Y'all know the realization we're facing. Does anybody want to deny anybody anything? No, but can you provide it for 40 million people or 100 million, and at what cost? And it's that balance is what we're trying to find. You know, the undocumented. Well, the people that come here that are documented and did it the way they're supposed to, they feel like people are skipping in line on them. And I understand that. We've got to be reasonable. We can't dig our heels in and assume that, that you're all right, because it's not. It's a compromise somewhere. What do we do to reach out to people who want to be in the land of opportunity, but at the same time not exposing the rest of the people to just horrendous and outrageous expenses? That's the balance. That's what we've got to come up with, not just in this committee, but in this state and in this country. And I think you know that. Finally, is Representative Everson still here? Yes. Your final thoughts, sir? Comments?
Thank you, Mr. Chairman, and the committee for hearing this bill, and to all those who've spoken. I think I have been mischaracterized here. Just as Representative Coleman said, whether you want to admit it or not, this state, this nation has a problem. Some say it's at the federal level where the resolve should come from. I agree. But in my district, and as I crisscross this state, and having served 23 years in the military, living abroad, and I too value those who come here from all parts of this globe. But this nation was founded upon laws. We have immigration laws by which you can become a natural citizen of this state. My concern is, what kind of message are we sending to those who go through the arduous task of applying for citizenship here in this country, to allow those who come by other means to enter illegally to receive the same benefits as those who have gone through that 7-year task of becoming a citizen? The resolution is not going to be easy for any of us, but this is an issue we have to address. We have to address it in the houses of faith. I am a Baptist minister, serving as associate pastor of Salem Missionary Baptist Church in Lilburn, Georgia, some 5,000. Our doors are open to immigrants coming in. I serve as the president of the Lilburn Co-op Ministries, a conglomeration of 32 churches in Gwinnett County. Our doors are open to immigrants coming in. Businesses, yes, they have to shoulder some of the responsibility as well. But as I have stated, in 1996, when this law was implemented under President Clinton, all of those areas are addressed. We need to enforce the laws that we have. Someone mentioned segregation. My grandmother died in a segregated hospital in South Georgia, Hawkinsville. I very well know what that is like. I don't want to see anyone go through that again, and I will be the first one to stand on the line to defend that. We're talking about denying health care to children. Maybe I didn't adequately address that in my bill. But my bill basically codifies what the federal government says. There are areas under my bill where you still will be able to receive public health assistance as far as immunization for children. It's outlined on page 2. I'm concerned about this. I'm concerned about the message that we're sending to those, as I stated earlier, those that come through the legal process. And many of them are my constituents from different land, different nations, who say, what are you all going to do about this? You've been talking about it for years. You've been talking about it for years. The only thing I want is for this nation to welcome everyone. And I welcome everyone, every law-abiding person that want to come to America to reach that dream. See, I'm from South Georgia. The cotton fields. Grew up in South Georgia. I know what it's like. Never thought I'd be here as a state representative. But God has given me a mission, and I'm here to carry it out, that we are to take care of those that are less fortunate. But we are to also honor the laws that are enacted and placed for us to be governed by. And if we don't honor those laws, maybe we should initiate some legislation to change those laws. Because right now, the system is broken. The healthcare industry, you're feeling it. The schools, you're feeling it. The houses of faith, we're feeling it. The state, we are feeling it. The federal government, we are feeling this. I'm not known to take soft issues. I tackle the hard issues. I am willing to work with each and every one of you. But I challenge you today. This issue will not go away. It must be addressed. Mr. Chairman, those are my concluding remarks. Thank you so much.
Thank you, Representative Everson. That concludes the hearing on this bill. And if I'll entertain a motion on adjournment. And we're out of here. Thank you.